All right. So we got the basics down. I think a lot of people are a little bit confused around where does OT start and behavior therapy stop or something like that. So can we look at those two for a minute? What happens in OT that doesn't happen in behavior therapy or vice versa?
Right, so I'm not trained as an ABA provider or a behavioral therapist, if you will. So I can only speak to the OT side of things and my personal experience, what I've witnessed. Behavior therapists base a lot of their strategies, their interventions on Skinner's work, which proved that given positive reinforcement, a behavior will happen again and again.
Mm-hmm.
So that's like the nuts and bolts of behavior therapy. The OTs are trying to dive down much deeper into the central nervous system at a neurological level and find a root cause of these behaviors. So it's not only shaping the behavior, it's actually identifying the root cause and implementing strategies that help solve the problem. So maybe these behaviors won't persist.
Mm-hmm. Okay, so let me say that back. Behavior therapy works with incentives, disincentives, maybe communication, how you convey what needs to happen, whereas OT, the focus is really on what's happening neurologically, how do we develop parts of the brain that maybe aren't tied to what a parent is or isn't doing at all.
Right.
Okay.
In behavior therapy, they look closely at the antecedent, the behavior, and the consequence. And they use that formula to collect data and try to change and shape behavior. In OT, we're trying to change the way their nervous system is processing sensory input in their environment so that they can have a more adaptive response to the antecedent. So ABA, behavior therapy, does a lot of conditioning type interventions, and OT wants that to be at a fundamental neurological level, that a different behavior just happens because we've really trained the nervous system.
Okay, makes sense. Maybe you can tell me the opposite. Where do you sometimes see overlap?
Yeah, well, a great behavior therapist or ABA provider and a great OT would work so well together. The OT can look deeper into the neurological level to find the root cause of the problem, help educate the behavior therapist on what's happening down here so that the behavior therapist can understand and implement strategies in a more efficient way as well. It's kind of a bottom up and a top down approach working in sync.
Got it. So you can work on the same skill, maybe a hygiene skill, but you're working at it from totally different directions.
A bit of different directions, yeah, but there's a lot of overlap there too. A behavior therapist might provide something like a visual schedule. When we brush our teeth, we have to get out our toothbrush, get out the toothpaste, apply the toothpaste to the toothbrush, brush for 2 minutes, rinse, spit, and all these visual steps would be available for the child to reference to help eliminate behaviors that occur because they don't know the sequence. The occupational therapist would also help break down the task to create that visual of all the pieces of the activity and to make sure that fine motor skills support the activity getting completed by the child, the visual motor integration skills are there for the child, and that they're in a well-regulated state to perform a task that's challenging.